My name is Anthony Schmelak. I'm professor of radiation oncology at Vanderbilt University. I've been here for approximately 20 years. I'm in charge of the head and neck radiotherapy for our head and neck cancer patients, and I coordinate my treatments with medical oncology and head and neck surgery to come up with a combined modality approach that's best for each patient. Radiation treatments are designed to kill cells that are actively growing, and our hope is that that will only be the cancer. However, there are certain cells in the patient, the skin and the lining of the throat, that are actively growing naturally. What the radiation therefore does 2 to 3 weeks into treatment is cause dermatitis, which is like a sunburn. And eventually, by the end of the patient's treatment, that can be bad in terms of patient's skin peeling or becoming very flaky or scaly and painful. Secondly, we cause mucositis, which is an inflammation of the mucous membranes. This can cause a burn-like sensation, loss of taste, excessive mucus, and difficulty swallowing. This may lead to what we call edema. Edema is swelling of the soft tissues of the neck, both externally and internally, that can look like swelling or cause difficulties with speech or with swallowing. Lastly, these may lead to what's called fibrosis, which is internal scarring of the soft tissues that might lead to neck stiffness or further difficulties swallowing or speaking. Mucositis, or an inflammation of the mucous membranes, generally starts about 2 weeks into radiation. This usually starts with a sore throat, but it can be accompanied by loss of taste and also excessive mucus production. How do we prevent or treat mucositis once it begins? Truthfully, we can do very little about it. We ask patients to gargle with salt water rinses or gargles as often as possible. We very commonly prescribe concoctions you get at the pharmacy called Magic Mouthwash or Miracle Mouthwash that tend to control the pH of the mouth, control fungal overgrowth that is common, or give you temporary relief for 5 to 10 minutes by numbing the mouth so you can get a shake or a meal down. The symptoms become severe by the end of treatment, and many patients need to go on liquid diet or sometimes even a temporary feeding tube. That's based on your weight loss during treatment. Typically, the mucositis lasts 6 to 8 weeks, and by that time, pain is generally better controlled. During treatment, we use narcotic analgesics like Lortab or Percocet, or even morphine or morphine-like patches that last for 3 days. Our goal is not to make your throat numb. Our goal is to make you generally comfortable while you're not swallowing. But even when you swallow under these medications, it tends to be painful. And therefore, it is quite a chore for patients to maintain their nutritional support. Dermatitis is another complication of radiation. It's similar to mucositis, but this occurs on the skin, generally from the ears and the bottom of the jawline down to the collarbones. It starts off like a redness, like a sunburn, but generally gets quite severe by the end of the 6 or 7 weeks of radiation treatment. This might lead to blistering or even peeling of the skin and can become quite uncomfortable. What we ask patients to do to minimize dermatitis is to keep their skin clean and dry and free of oils or detergents or fragrances. We also ask them to limit their sun exposure to only 15 minutes a day if you're going outside. We also ask them to wear clothes that don't rub on the shoulders or the lower neck. In general, it takes 2 or 3 weeks for radiation dermatitis to heal after treatment, and generally does not cause scarring, but might cause difference in pigment of the skin for 3 to 6 months. A potential long-term complication of radiation is lymphedema. This is a swelling of the soft tissues of the face or the neck. It is complicated when patients have surgery and radiation because of internal scar tissue formation. In general, there are some things we can do to prevent it and some things we can't. If patients develop lymphedema, it is typically during the second and third months following radiation and is noted most of the time when patients get up in the morning when laying flat at night, and improves during the course of the day as gravity pulls some of the fluid out of the neck. In general, we ask patients to see a lymphedema specialist where they get instructions on how to minimize it with wraps and with exercises and massage therapy. Sometimes the lymphedema can occur internally, which can affect swallowing or speech. In those circumstances, we send people to speech and swallowing therapists, which will give you maneuvers on how to position your chin or your shoulders during swallowing that will assist so aspiration doesn't occur. Fibrosis is a potential long-term complication of radiation and is worse in patients who have also had surgery along with radiation. It's a term we use for internal scarring of the soft tissues of the neck. Patients can complain of stiffness or limited range of motion, or potentially even cramping of their neck muscles when they move their chin one way or another. Typically, we ask patients to perform neck stretching exercises during treatment to minimize this. But if it gets severe after treatment, we often send patients for physical therapy to do stretching exercises and to minimize the discomfort and improve the range of motion. These side effects of mucositis, dermatitis, lymphedema, and fibrosis are unfortunate, but happen in most patients. We give you instructions during treatments to minimize these side effects, but in general they occur, and our goal is to get you through treatment without a break.